Dr. Shruti Gautam. I'm a plastic surgeon. Today I am here with Dr. Anshuman Manaswi. He's a plastic surgeon and the director of La Transformation Clinic and the Mumbai Breast Center. I am here today to address the most frequently asked questions with respect to breast augmentation that we have received from patients. So Dr. Anshuman Manaswi will answer these questions and try to help out the patients to the best of our ability. So sir, I would like to ask you my first question. Are you a board certified plastic surgeon?
Yes, I am a board certified plastic surgeon and I have 20 years of post plastic surgery experience. Overall, around 25 years of surgical experience.
So sir, do you specialize in breast augmentation surgeries?
As a plastic surgeon, my practice is almost 80% cosmetic practice, and breast augmentation is one of the most commonly performed surgeries.
So sir, where would this surgery be performed?
This surgery is a daycare surgery in most of the centers now, where you operate, patient gets operated in the morning and gets discharged in the evening. We have our own center where we perform this surgery. But if the patient wants, we can give that option to the patient to get it done at any hospital of her choice.
So who according to you is the ideal candidate for a breast augmentation surgery?
Now, it's a debate actually. There are girls whose breast is underdeveloped and they tend to benefit a lot by augmentation of the breast because small breasts give rise to inferiority complex to many of these and their confidence level comes down. Such girls, many of them have one-sided small breasts. So these are the patients who are benefited the most, as I would say. But then there are girls who aspire to be in the industry, film industry and all that, and there's a professional need, so they want to have breast augmentation. And the third thing is, after the childbirth, the breast sags a little bit. If the sagging is not too much, then breast augmentation will increase the volume as well as will lift the breast. So these are the three kind of people. And the fourth kind of people are the transgenders who want to convert from male to female. They have a great desire to have a female-like breast, and breast augmentation helps in that.
So what are the procedures that are used for the breast augmentation, whether it is fat injections or whether these are implants?
Okay, implants have been time tested. They are very, very safe and they offer us the results which are absolutely symmetrical, very nice, with the same consistency of feel, and the interpersonal relation also doesn't get affected. There are some inherent problems associated with the implants, so one must be very, very sure to make sure that to come to a doctor whenever there is any such problem arising. We can discuss on that later on. And the fat transfer has come into vogue for last 4, 5, 6 years. It's a great thing because there are no cuts, no scars, and the fat, particularly if you have a fat in the body, it adds the advantage of a liposuction in addition. The only disadvantage of a fat, in my opinion, is that part of it gets dissolved. So actual volume which we have put, it comes down a little bit, maybe in the tune of 20 to 30%, occasionally around 40%. So anybody undergoing a fat transfer must be aware of this, that if the fat volume loss is less, is more, then in that case a repeat fat transfer may be required.
So what is the filling of the implant that are used? Is it saline or it is silicone?
No, it's mostly silicone implants which are there. Saline implants are almost over long time back, and saline tissue expanders are used definitely at times. If somebody wants a bigger volume and the skin envelope is very small, then in such cases the expander is put, it is inflated with saline, increased to a larger size to create a bigger envelope, and then an implant is put.
So, and what would be the shape of the implant be? Would it be a teardrop shaped or would it be a round implant?
Mostly the round implants is being used because even if the implant rotates inside the body, there is no deformity as such. With teardrop or a pear-shaped implant, which there is a top which is a little more curvilinear than and projected, in case there is some implant rotation, then it shows. So, I mean, we tend to use round implant much more frequently, almost around 99% of the cases.
So, how do we all decide the dimensions?
A very important question, and very important for people to understand that the dimension, the size of the implant will depend on the size of the skin envelope. You can put a pillow only as much as the pillow cover allows. You may be having any expectation, but in a single go, if you want a very big implant and your skin envelope is tight, we may not be able to fulfill that. Of course, in 2 sittings, we can try to give that. So we take various measurements and we see the skin laxicity, and then we decide. There are charts of each implant company which we refer to at the end of taking the dimension, and accordingly decide the implant size.
What care should a patient take, sir, after a breast augmentation surgery?
The first 7-10 days are very crucial, and we are very particular that the patient maintains good hygiene and comes regularly for follow-up to check if there is any infection. And if there is no infection after 7-10 days, nothing much needs to be done. Later on, one has to understand and feel how the breast is, do breast self-examination, see if there is any hardness coming, or in case there is any distortion of the shape. In that case, they must see. I personally advise all my patients to undergo ultrasound every year and after the implant, and to check in case there is any problem on the ultrasound. That is the screening procedure.
This was one of the most frequently asked questions, whether the patient would be able to breastfeed post an implant surgery.
Yes, without any problem, because the breast implant is put underneath the breast, in between the muscle and the breast tissue. So there is absolutely no question of why a lady may not be able to feed after breast implant.
And the second most common question asked was that, is there any predisposition to cancers post an implant?
Yeah, that's again a very, very important question. So, breast cancer is one entity in which there is no proven evidence to say that breast implant causes breast cancer. But there is one particular type of lymphoma which in the last few years there is some evidence to suggest that some of these patients, especially those who have undergone coarse capsular implant cover. Coarse capsular meaning that the implant, there are 3 types of implant. One is a smooth, one is there are micro serrations, and one is there are coarse serrations. Coarse serrations are able to hold the breast much better. But these coarse serration implants have been associated with what is called as breast implant associated NFL, breast implant associated adult lymphocytic lymphoma. So yes, there is some evidence to that. The smoother implants, there is no such evidence as of now. So, and the treatment for that is removal of that whatever small tumor which occurs. I can understand that this is distressing, but to be very, very candid about it, if you know that you are there is a problem, you just have to do a simple screening every year to see if there is a problem, and in case it is there, you can get it treated. Remember, there are pros and cons of first fat transfer vis-a-vis the breast implant. Breast implant are very consistent, is giving the best result. If somebody wants, it has to be done, and Monitoring obviously is required in my opinion. If you have enough fat, go for fat transfer. Be prepared for 2 sessions, and I think that is also equally good.
So the last question that we have frequently been asked is, does the implant require replacement over a period of time?
That's a very difficult question to answer, because many patients the implant lasts for 15 years, 20 years without any problem. And there are patients in whom there is some amount of capsular distortion which is there, which necessitates, or a painful breast, which requires the implant change. So there are no fixed rules. But if an implant has been put now, and after 15 years, the breast architecture itself changes. So what desired cosmetic result you got then, around 15 years back, may not be very aesthetically pleasing after 15 more years, because breast implants remain over there, the breast sags, so it's kind of a deformity. So even if it is not causing any problem, many patients want to remove it.
I hope we've answered most of the questions that were posed to us. Thank you.
I would like to add a few things over here. Number one, in case you have any further questions, you can write to us, and we'll be more than happy to address them in a personal manner, as well as have another questionnaire sessions to help you all. And the second thing is, think of today what is best for you, decide, and take whatever necessary precautions are required for the future. Be careful, don't be afraid. Thank you.
Thank you.